Hi. Hello. Hey, hey, hey. Hi, hi, hi. Thank you for joining. Thanks for watching us on the replay. For those that are watching us on the replay, hope you had a good weekend. Alrighty. I'm going to be talking with you about, 8 diseases. Oh, I forgot to say, I was supposed to put 8 cardiac diseases. Oh, I'll update it. Does this include the next generation NCLEX? No, because so here's what I'll tell you about the next generation NCLEX. Um, what I'm talking about right now is diseases. The main thing that's changing with the next gen is the formatting of the question. So, like in the past, it would be in the past when it comes to the way the test is right now, you would want to be aware of, okay, based on by specific disease. But with the next gen, the specific disease process, which is what the title is not going to be 100% the only relevant factor, like as far as differentiating between what I'm talking about now and the next gen. So, long story short, this topic is not um, can apply to the next gen as well as also the current test, because the next gen is all about the formatting of the test, the way that you look at the questions, the way the questions are answered. So it's not necessarily about what I'm talking about as far as like the diseases. I hope that kind of makes sense. Yeah. All right. So let's talk today, and go ahead and comment below and just let me know where you're tuning in from. In the comments, say hi. Hi, I see you. Oh, that's so good to see you. Hello. Welcome, welcome. Tell me where you're tuning in from, when you take your test. Hope you're doing good. Yes, yes, yes. Okay, good, good, good. I can see you. Thanks for coming on in. So, hello from Houston. Hi. Hello. Good to see you. Welcome. Thanks for coming on board. Glad you're here. Who's taking their test right now? Who's taking their test before the end of the year? And who's taking their test next year? Put 1 if you're taking your test before the year is over, and 2 if you're taking it next year. 1 if it's at the end of the year, by the end of the year, or 2 if you're taking it next year. Hello from Chicago. I see you. Hello. Welcome. Thanks for coming on. Good to see you. Thank you. Awesome, awesome. 1. Okay, I see 1 so far. 2. Hello from Tampa. Hello. Welcome. Thanks for joining. Romania. Wow. You live in Romania? Wow, that's amazing. I think that's the first Romanian person I've seen. You have a test on December 19th? Awesome. 2. Okay, cool. All right. Okay. New Jersey, 2. Sounds great. Perfect. Awesome. Thank you for sharing. Okay. So, while you guys are commenting, before we get started, I want to just mention really briefly, we are having a 2-day NCLEX content review class. Oopsie. We are having a 2-day NCLEX content review class. For those of you, if you already registered, I see you too. If you already registered before, there was a mistake with the date, so I updated the date now. So it's actually supposed to be this upcoming Thursday. So it's going to be this Thursday, December 1st and 2nd, for those that want to join my free 2-day NCLEX content review class. You can register for free if you click the link in the bio on Instagram, or if you click the link in the comments on Facebook or YouTube. You can register for it that way. It's going to be a great experience. Definitely show up live. And like I mentioned, it's actually a free experience. So I'm preparing. Oh, you're pre-preparing for when you enter school. Wow, okay. You're on top of it. Awesome. Okay, so let's talk about 8 different diseases that you definitely want to learn and know. And hopefully what I'll do is hopefully it will help you to think a little bit differently and better. All right. So the first one, if you want to comment, if you want to share in the comments that you're learning and you're picking it up as far as like what the ones I mentioned, you're welcome to do that. The first one is going to be CHF. CHF. So these are all going to be different diseases that it's relevant for you to understand, regardless if you're taking next gen or if you're taking the test before April, you need to understand this period, you know. So the first one is going to be CHF. If you know what CHF stands for, go ahead and put that in the chat as well. If you already know what CHF stands for, go ahead and let me know that in the chat. CHF. CHF, okay? So CHF, what does that stand for? That stands for congestive heart failure, right? Congestive heart failure. Thank you. So the biggest thing is like you have to understand, why does somebody develop CHF, right? What happens that triggers it? And then how does it progress to CHF? And then when are they considered exasperated or acute? And when is it non-acute, right? So for different disease processes, it can be, for chronic diseases, they can be exasperated, which also means they're experiencing acute-like symptoms, which means that they need to be hospitalized until they get better. So the biggest key for when it comes to nursing and thinking like the nurse and etc., is to process and realize, okay, what are the signs and symptoms that indicates that the patient is in an exasperated form of CHF, right? And so typically CHF, usually it starts off with a heart attack, right? That's usually one of the precipitating factors, is that they'll first have a heart attack, and then based on whether or not how well their compliance is as far as their meds, exercise, diet, etc., then it will progress into CHF. And then at that point, it needs to be managed with like fluid control and like diuretics, like Lasix and etc. Right? So you need to understand what triggers it, why does somebody have it, what are the signs and symptoms that's exasperated. And usually the signs and symptoms is exasperated is they're complaining of shortness of breath. And they're having edema, especially in their feet, right? So the edema is more worse, or it's new. Like it's not, they're not used to having edematous feet. So these are some of the issues that we have to be concerned about with CHF. And then what tells you that they're getting worse, right? So what would it look like that would tell you, okay, man, this patient's getting worse, right? So the biggest thing would be the breathing is getting worse, because CHF is usually a fluid overload problem. There's too much fluid in their body. So if their breathing is getting worse and worse and worse, despite treatment, then they could be going into different problems like pulmonary edema, cardiogenic shock, and etc. So when you're learning different diseases, for the sake of the NCLEX, as well as thinking the bigger picture and thinking more critically, is one, understand what triggers it, understand what triggers that problem, understand what would be the signs and symptoms that they have it, what would be the signs and symptoms that it's exasperated, meaning that it's acute. And then also, how do we treat it? How do we manage it? And what tells you that they're getting worse? What are the complications that they're getting worse? Those are the top things you have to ask yourself in order to better understand this disease, as well as any other disease process. Okay, that's number one. The second thing is, like I was just mentioning, is MI, myocardial infarction. Myocardial infarction, okay, which is also known as a heart attack, right? So same thing as well. What usually triggers a heart attack? And usually what happens is that the patient first develops atherosclerosis, or I should say coronary artery disease. And what that means is that the arteries in their heart gets clogged up with plaque. It's like a yellow substance. And that causes a sudden occlusion in blood flow. And because there's a sudden occlusion in blood flow, the patient suddenly has a heart attack. So literally the blood flow just stops completely. And they're complaining of like they can't breathe. You look at them, they're sweating, they're pale, they're diaphoretic. They're having a true heart attack. And if we don't give them some aspirin, if we don't give them some nitro, they're not going to make it, right? So with the MI, also known as myocardial infarction, that's typically what it looks like. Here's one thing that's really important when it comes to exams is many times there's different terms that means the same thing. So you have to recognize that a lot of sometimes you'll see different terms and it's the same thing, but if you have not studied both terms, it's going to throw you off and you're not going to realize that it's talking about the same thing. So for example, if somebody has a heart attack, like I just said, like a simple example, a heart attack is also called a myocardial infarction, right? So you have to be familiar with what are the similar names or different names that the same disease process can have. Okay, so hopefully that makes sense. So number 2 is the MI. Number 3 is CAD, or coronary artery disease. So coronary artery disease, this is a problem where the patient, like I was just saying right now, their heart is the arteries in their heart are full of plaque. Okay, so what we don't want to happen is, and I hope, like, I wish I could pull up like a picture so you guys could see. Remember to start bringing my heart. Like I have a heart, a physical. It sounds like I have a heart, right? Yeah, I have a heart too, but I have a heart diagram, and like it allows you to, so you can literally see what it looks like inside the heart. But essentially, in the arteries within the heart, those arteries are clogged up. And so that's what results in coronary artery disease. They have a problem where the arteries have too much plaque in it, and then that affects and hinders the patient's blood flow, right? So you have to be thinking once again, what triggers? What are the signs and symptoms, right? What, especially if it's acute, and then also what do we do to treat it? What are the interventions? And then what are the complications? What tells us that the problem is getting worse? So with CAD, when they have coronary artery disease, if it gets all the way occluded, then that's when they have the heart attack, like I just mentioned, the MI, right? So that's one of the things as far as like CAD, it's very common. The reason why it's common on the test is because it's common in real life. A lot of patients are diagnosed with CAD, and usually it's triggered because their diet is full of fat, chlorides, lipids, like a lot of fatty foods, and over time that results in the arteries in the heart becoming occluded or blocked. Okay, so that's the third one was coronary artery disease. Number 4 is angina. So angina, so do you know there's different types of angina? Not all angina is created the same. So angina is where essentially they complain of chest pain, right? So they're having chest pain, and because they're having chest pain, they can have unstable angina or stable angina. And they have to realize the difference between angina that's cardiac versus angina that's respiratory versus angina that is digestive, right? So anytime a patient complains that they're having chest pain, as a nurse, you have to follow up with the appropriate questions to identify what type of chest pain they're having, right? To recognize, is this truly a cardiac issue or not? Because if it's not, then you're not going to give them aspirin and nitro, right? You're gonna do something completely different. And so you identify that by asking questions like, okay, when did it start? What triggers it? What does it feel like, right? These are different things that you will ask to identify what is the true core to what's the true cause of their issue. All right, then the next one, number 5, is hypertension. If you have seen, I posted a video on here or a picture where I talked about the different types of hypertension. Have you ever seen that video? Well, I posted it on our channel, and essentially what I was talking about is there's different types of high blood pressure. And so for a lot of students is that if you don't recognize that there's different types, it's easy to not see that on the test. So there's actually something called primary hypertension. Primary. Primary hypertension. Primary hypertension is the most common types of high blood pressure, right? Usually that's about 90 to 95% of cases. And primary hypertension is also known as essential hypertension. And it's pretty much not based on a specific cause. But then you also have, hold on, I need to charge this. But then you also have something called secondary hypertension. And secondary hypertension, that one is called non-essential hypertension. So think about this. Imagine if you take the test and it asks you which of the following does the patient has blah, blah, blah. This is what's going on. And it asks, which of the following would best describe what the patient is experiencing. A, hypertension. B, primary hypertension. C, essential hypertension. So I should say non-essential hypertension. Or D, none of the above. Right? So if you're not familiar with the specific type, you're going to easily pick the wrong answer. And so that's one really important thing. And that goes back to what I said earlier as far as knowing the different names of the same thing. That's really going to make a difference with learning and retaining the content and recognizing on the test. Okay, so hypertension is number 5. All right. Number 6 is TOF. TOF. Who knows what that stands for? Do you know what that stands for? TOF. Let me see if I get any comments. TOF. Who knows what that stands for? TOF. And let me give you a hint. So far, all of the diseases I've been mentioning are all adult problems. Okay? All adult problems. TOF. I'm going to give you guys a couple of minutes to see if you can comment. If not, then I'll just move forward. Okay. Okay. All right. So TOF stands for Tetralogy of Fallot. Tetralogy of Fallot, right? So it's essentially a cardiac problem that occurs in pediatrics or babies. And this is where their heart has 4 different defects. Oh, thank you. Thank you. Good job. All right. Pretty much their heart has 4 different types of defects. And as a result, because they have 4 different types of defects, they're not getting adequate oxygen, tissue perfusion. They have what you call TET. I want to say it's either TET, it's like TET spells. And that's where like their body goes blue. They're not really getting adequate perfusion. So it's 4 different types of defects. You do need to know what are all each of the 4 types of defects. I can't remember every single one off the top of my head, to be honest. And I don't want to say I know it off the top of my head. but one very specific defect that's really bad is the defect where it's between the left and the right ventricle. So that's really, really bad. So there's pretty much a hole between the right and the left ventricle. So that's really bad because the way that blood normally works is that you're supposed to have deoxygenated blood that goes through the right side first and then it goes to the lungs. So if blood is mixing and it's going through that hole, it's not going to get adequate perfusion. So that's one of the significant things about TOF is that they're not getting adequate oxygen perfusion. And usually they have to have multiple surgeries before it's completely corrected. Okay? All right. Okay, and then number seven, is this helping at all? Are you guys learning something new? If you are, comment below. Let me know you're learning something or you're, gathering some information. All right, number 7 is pericarditis. Pericarditis. In fact, I think I should put this here. Pericarditis. Okay, so you have to know the anatomy of the heart. Okay, you got to know the anatomy of the heart for all this stuff to make a lot of sense. Because you're not going to remember it if you don't know how the heart normally works. So pericarditis is essentially a problem where the heart, there's a layer around the heart called the pericardium. All right, there's a layer that's around the heart called the pericardium. When somebody has pericarditis, that layer is inflamed. And so because it's inflamed, that's why they have pericarditis. One of the biggest differences with the pain of pericarditis, because it occurs in the chest area too. So remember, you have to be able to differentiate different factors that separate one over the other. So true chest pain that's a heart related, like for example, MI, is more like dull, achy, and usually it triggers maybe like stress, or if they have unstable angina, it triggers even with rest. But pericarditis, though, they do have chest pain, but the chest pain is usually sharp and acute. And usually it can occur because of history of like common heart problems, drug abuse, viral infections, bacterial infections, and then also chest contusions or chest trauma. That's pericarditis. And so with pericarditis, it can improve over time. So what typically the goal is that we want to do the least invasive thing always. But when that doesn't work, then we'll do a procedure where they'll do like a pericardiectomy. Well, they'll remove a piece of the layer of the heart of the pericardium. They'll remove a piece of it, and then if that doesn't work still, first they do. I'm saying it right. That's what they usually do. Then after that, then they'll do like a pericardiectomy completely, or pericardiotomy. First pericardiotomy and then pericardiectomy. Sorry, I'm mixing up the suffixes. And that's where they take off the whole pericardium. So once again, pericarditis, this is a problem where there's a layer that surrounds the heart, and that layer is inflamed. So that's part of the anatomy of the heart. That layer is inflamed, and it's because it's inflamed, they're having pericarditis, and they need to usually be on like medications, antibiotics to help relieve and heal that as well. Okay, so that's number 7 is pericarditis. And then number 888 is left versus right CHF. Left versus right CHF. Do you know the difference between right and left CHF? Do you know the difference? Are you confident? Because that is something that you would definitely see on the test, is being able to recognize signs and symptoms of right versus left. So when they have right-sided heart failure, their symptoms are different. So they'll have something called increased jugular vein distension. So what that means is that on the right side of their body, the veins here in their neck will be extended. or I should say distended. And then they'll have ascites, and then usually also they have edema that occurs mainly at night. But when they have left-sided heart failure, though, instead they'll have that chest pain, right? And then when they have that chest pain, I'm sorry, not chest pain. When they have left-sided heart failure, they'll have more pulmonary issues. All right, more pulmonary issues. So instead, now you're going to see difficulty breathing. Um, they'll have more problems, especially with like fluid overload. They could also have pink frothy sputum if it's getting a lot worse. So left equals lung, right equals, actually there's no really acronym for right, but when it's left-sided though, it's more lung issues or pulmonary issues. When it's right-sided, it's more like JVD, it's peripheral issues, things going on with the peripheral venous system. All right, so that is the 8. Let me see, did I get all of them on here? Yep, I sure did. All right, so let me do a recap one more time. Number 1 is CHF. Number 2 is MI. Number 3 is CAD, coronary artery disease. Number 4 is angina. Number 5 is hypertension. Number 6 is TOF, Tetralogy of Fallot. Number 7 is pericarditis. And number 8 is left versus right CHF. So the reason why I want to emphasize and separate 1 CHF number 1 and then 8 left versus right is because it is very significant that you not only understand what CHF is, but then you have a clear understanding between left versus right. All right? Alrighty. Okay, so let me know. I hope that you found that helpful and you learned something. If you did, go ahead and put yes below. If you're watching this on the replay, put yes. And then also, if you haven't already, make sure that you register for our free training, our free workshop, our 2-day NCLEX content review class. Definitely want you to be there, especially if you really feel like you need help with understanding the content. I've done the class before for free, and I've gotten such tremendous great feedback. People really loved the teaching. So you're welcome. Go click the link in the bio on Instagram right now and register for it. And then if you watch this over here on Facebook and YouTube, just simply click the link below to register for it. It's happening this upcoming Thursday and Friday, all right? And also last but not least, if you want to get our books, I don't have them in my hands now, but if you want to get our books, you still can do that for our Cyber Monday and Black Friday promotion. All right, and I think that's it. All right, you guys have a wonderful rest of the day. Thank you for watching. Share this with somebody, share or tag if you found this helpful, and I'll see you the next time. Take care.